And the procedure was we were quite guided from one step to the other. No time was wasted. From the day we landed, the next day she's having all the checkups that she needs. The next day is the surgery. They are checking with us every time. They are answering all our questions. So the procedure was very efficient. My name is Liran. I'm the son of Amira who had the surgery here. This is actually the second surgery she's having with AIMIS. We are from Israel. While we in Cyprus, a week ago, she had a surgery, quite a complex one. First of all, we are talking about extremely severe pain. And it got worse over the years. For example, a few years ago, she did feel pain, but she could still walk. Like we were traveling to some countries abroad, she could work, and sometimes the pain was quite strong, but she could manage. Lately, in the last year, maybe the last 2 years, the pain got so severe that she can't even walk 50 meters without having to stop. Actually, it was by chance. My sister, she's also kind of a therapist, and she gave treatment to Dr. Barbalak's son. And she talked to his wife, and she told her that my mom is suffering from many years from back pain, and this is how my mother was introduced with Dr. Barbalak. When he saw her and she did all the CT, MRI, all the tests, then the idea of having the surgery here in Cyprus by AIMIS, it came up with conducting it by Professor Smith, that he has a very unique technique of having surgery to treat this kind of situations. This is how we got acquainted. Actually, we went to see several surgeons in Israel, also a special clinic that specializes with pain. Some of them actually said to my mother that surgery won't help her. Some of them even said that a 75-year-old woman it's not a good idea for her to have a surgery to treat back pain. So actually, what Dr. Barbalak and Professor Smith suggested, it was actually the only solution that really suggested a recovery to significantly reduces the pain. At home, she tried many other techniques. She tries pins, and she tried some shots against the pain. It didn't work. So that was actually the only treatment that we could consider. Actually, we started talking to Irani several weeks before we arrived. When the insurance approved everything, she managed actually everything, from the insurance to the AIMIS, to the hospital, to the hotel, to the transportation. You see, I also asked to upgrade the room. Irani assisted me with this. Actually, every request, even some strange requests that I had, she treated it very professionally, very kindly, with patience. First of all, things here are going very, very fast. In Israel, you want to have a test, all the tests, the checkups that she did here in 1, 2, 3 hours. In Israel, it may take several days. It's a good practice. The doctors in Israel are also very, very good. But the technique that Professor Smith and Dr. Barbalak offered here, it's not something that would have been available in Israel at that time. If we would have decided to have the surgery in Israel, it would probably had to be split for several surgeries, not to have it all, not to treat all of them only in one procedure. And it will also take, I assume, many months to get over, because some of them will have to be done in public hospitals, and the waiting line for it is quite long.